Good afternoon, everyone. Thank you for joining us. We are going to wait just a minute to allow people to jump on. Recognize some names. Good to see everyone. Thank you for joining. Always love to know where people are from. If you don't mind in the chat, just letting us know, are you a parent, a professional? Are you in Colorado, outside of Colorado? As we wait to get started. Are you liking the cooler days if you're from Colorado? Ready for spring?
I sure am. I'll tell you that.
It is so nice to have the window
Yes.
open and the cool, crisp air coming in. It's so nice.
Yes. I was in Texas before this, and so any hint of fall and being able to go outside is much appreciated.
Yes. Oh, I get that. Hi, Sharon. Thank you for joining. We got someone from Colorado Springs, a parent. Anyone else want to share? Parent, professional? Where are you located? Aurora, parent, karate teacher. Yes, awesome.
Awesome.
Parent and karate. And so many of us, I know, are parents and professionals. That's how I get started in Guiding Bright Minds. All right, we're at 12:02. So I am going to go ahead and get started while we allow people to jump on. But good afternoon, everyone. I am Tiffany Feingold. I am the co-founder of Guiding Bright Minds. It's wild to say that Guiding Bright Minds is going on its 5th year. But as a parent of a neurodivergent child, neurodivergent myself, it's been quite a journey, and also married to somebody who's neurodivergent. So it is a fun household, but my passion is obviously supporting our neurodivergent children, but my passion is parents. Because as one, I know how overwhelming, how exhausting that journey can be. And starting so early with my own son in, half day kindergarten in the principal's office every day. And it was perplexing to me just how limited the flexibility of supporting our children, the lack of understanding. I think that's out there. And so I decided to leave my 20 year career to start Guiding Bright Minds, to help other parents to know that, all the providers that are listed in the Guiding Bright Minds directory have been vetted. I personally meet with every one of them to find out what they're doing, how they're supporting the community, what that looks like. I'm big in just connecting with other organizations, how to best support, where we all come together collectively to provide these resources, to educate and train. If you guys have not been to the Guiding Bright Minds website, that's where my neurodiversity directory is, where you can search for different providers depending on your needs, from tutors to educational advocates, psychologists to specialty schools. So a wide variety of services. We post all of our events. I'm not sure if you all are aware, but I just launched a few months ago a parents' night out event, and you can bring your children with to this event. It has been amazing. Our next children's night out event is going to be on Wednesday, September 17th from 4 to 6. It's at Tepiak Community Center. And we'll have all of that information on our website. We post it on all our social media outlets. So definitely check that out, along with all the free parent webinars and other services we're offering the community. And I just want to thank you all again for taking time out to join us on this webinar, because this is time for you too as a parent. And that's, again, one thing I'm big on. And I'm so excited for this conversation. It's actually a new topic that we've had on our free parent webinar. So thank you. I want to first introduce you to Dr. Alison Datoc. She's a licensed neurologist and a concussion specialist. She's with Horizon Neuropsychological Services. And she's here to talk to help us because you know what? That's as kids are getting back to school. We know head injuries and we know what the impact can be if they're not understood or taken care of. So, Dr. Datoc, thank you so much for joining us and being here today. I will turn the webinar over to you.
Awesome. Thank you so much, Tiffany, for the introduction and everyone for joining us today. Really appreciate all you do, Tiffany. You know, life is all about connections and relationships at the end of the day and how we can best learn from each other. So the community you built, it's really great. And I just want to be a resource for this very niche topic, concussions, right? You know, I think most of us here can either say that they know someone or have had a concussion themselves. So it's a very relevant topic, yet there's still a lot that a lot of people don't know. It's uncharted waters for many. It can be a stressful time when someone gets injured and not knowing who to go to and what to do. And there's a lot in the media, myths and misconceptions too, that are being tossed around. And so I'm here today to help educate you all more about this injury, how to best manage it, and especially in neurodivergent youth. And this is applicable to just neurodivergent individuals in general, because we can all respond to this injury in different ways, and especially the signs and symptoms in those who are neurodivergent can look different as well. So I'm going to share my screen. Okay. Do you all see that okay? Excellent. All right. Well, today's topic is very timely. Kids are back in school, right? They're back in sports and activities. And this means there's an increased risk of hitting our head. Just incidentally, concussions do have the highest rates in the fall. And so I want to get ahead of it, educate the community on this injury and how we can respond to it should it occur. I just want to briefly introduce my group, Horizon Neuropsychological Services. Tiffany gave a little bit of an introduction, but we have offices located in Littleton and in Boulder, Colorado. We also see patients virtually on occasion, and we have multiple neuropsychologists on staff. We see children and adults all across the lifespan for neurodevelopmental, neurodegenerative, psychiatric, complex medical conditions, anything that impacts the brain and the behavior and that requires further evaluation. I also spearheaded our concussion clinic. We opened just this past year, so coming up on a year, where I serve patients specifically with head injuries and help rehabilitate them to get back to school, back to activities they love, back to work, you name it. When we have this injury, it can be uncertain how to just go about our daily life. So I provide that guidance. All right. So just a little bit of background about who I am. Why are we listening to me talk today? So I'm a clinical neuropsychologist. I have specialty training in sports neuropsychology. So after all my schooling, I decided to do 2 additional years, very much focused on sport concussion, but seeing concussions in individuals of all ages across any type of injury, motor vehicle accidents, falling off the monkey bars, you name it. I've worked with athletes from the youth level all the way through collegiate and professional as well. I did my training down at UT Southwestern and Children's Health down in Dallas that has a very robust concussion care system and recognized gaps in the state of Colorado in terms of timely access to care and expert care as well with this injury. So like I said, a year ago, started up this concussion clinic to best serve patients with this injury. I see patients across the lifespan as young as age 6 and as old as age 100. We also have neuropsychologists at our practice who see kids as young as age 3. And that picture of the figure skater there, that's me. I do have A history as an athlete myself, a competitive figure skater, and so especially when working with athletes, that athlete culture is so important to acknowledge as we're returning them back to activities. All right, so as far as what today will look like, we'll start off by talking about recognizing concussions, especially in neurodivergent youth. We'll talk about the neuropsychologist's role in concussion management. Now, many people treat this type of injury, but why are neuropsychologists best suited to treat this injury? We'll talk about safe return to learn and return to play protocols. So we get this injury, how do we get back in the classroom and get back to sports and activities as soon as possible? We'll then talk about interventions and referrals if needed during this injury and the recovery process. And then I'll provide some resources for further information as well as my contact information. I'm here to be a resource for you all. My passion is educating the community and providers on this topic. So always happy to chat. It's my favorite topic. I did want to mention too, I love just a collaborative webinar. So if anyone has any pressing thoughts, feel free to shoot it in the chat and Tiffany will answer. But also we'll have some time for Q&A at the end as well. Okay, so why is this important? Why are we talking about this today? Approximately 3.8 million concussions occur each year, and this is only during sports or recreation activities. We know that concussions can happen with car accidents or slips and falls as well, so this number is actually probably artificially low. About 5 in 10 concussions go unreported or undetected. So the need for education on this injury and being able to recognize it is so important, so we can get people back on the road to recovery as soon as possible. And research has shown that athletes with ADHD, learning disabilities, or who have a history of both have a greater history of concussion, so a greater number of concussions in their past compared to those without neurodevelopmental conditions. So this is especially relevant for the communities that we serve, and even more of a reason that we need to be knowledgeable about this injury. So again, why is this important? We only have one brain, right? We want to take care of it, both in the short term and in the long term. We know that this injury can affect people in school, their activities that they love, the sports that they're involved in. And it's really important that our community, parents, teachers, school administrators, coaches, you name it, we should all be aware of this injury and their role in helping the child recover, because it takes a village, right? And we have a village surrounding our kids, and how can we best help them while they're on their road to recovery? Many signs and symptoms of this injury are not visible, so it's very important to be knowledgeable about how one might express their changes or just subtle changes in behavior that might occur after hitting your head. And at the end of the day, knowing what to look for, where and when to seek care can make all the difference on recovery. So we'll start off talking about what a concussion is. So a concussion is a type of traumatic brain injury, a TBI. It's a type of injury that occurs due to a bump, a blow, or a jolt to the head. And it can actually occur due to a jolt to the body as well. This causes the brain to bounce around the skull. I like to make the analogy of our skull being an eggshell and our brain is the egg yolk, right? So that yolk is bouncing around in our eggshell, and this causes chemical changes in the brain. This can sometimes damage or stretch brain cells, and as a result of these chemical changes, this is how symptoms can occur. Now, this can occur due to a direct injury to the brain, so hitting your head on a wall, getting hit in the head with a soccer ball, right? There's also acceleration, deceleration injuries. So many people don't know about this, but say you're in a car accident and you have whiplash, your brain can actually bounce around your skull and cause a concussion without even hitting your head. And then there's also blast injuries. So this is very commonly seen in military populations, for example. The blast from an explosive device, the waves in the air can actually cause a brain injury as well and penetrate the head. So in terms of traumatic brain injuries, there's three different types. We put them into buckets based on these criteria here. So based on loss of consciousness, amnesia, which are memory difficulties, the Glasgow Coma Scale, it's a measure of responsiveness that emergency personnel often use, and brain imaging as well. Today, we're talking about the mild TBI. So a mild TBI and the word concussion, they're used interchangeably. What it means is that that individual had less than 30 minutes of a loss of consciousness if they lost consciousness at all. Their memory difficulties are less than 24 hours. So, for example, I'll see kids who got injured in the middle of a football game. They might not remember the first half of the game, or they might not remember being pulled to the locker room and getting evaluated. That's very common, these kind of short, brief memory lapses, but it's not lasting longer than a day. The GCS, like I said, is a measure of responsiveness. So they're generally able to blink, to speak, to squeeze their hands, respond to these measures. And then brain imaging is more often than not normal. If there is a skull fracture or bleeding in the brain, and all of these other characteristics are within that mild range, it can still be classified as a concussion. More often than not, concussions do not show on imaging. Those positive findings fall in the more moderate and severe TBI range. So like I mentioned earlier, there's a lot of myths and misconceptions floating around the media in terms of this injury. And also just in terms of concussion and what we know about the injury, it's rapidly evolving day to day. And so some of these myths and misconceptions are just as a result of what we maybe didn't know a decade ago. So one is that there are different concussion severities. What we know is there's actually no such thing as a mild or a severe concussion. It's either there or it's not. It's like a broken leg, right? We either broke it or we didn't. There are mild TBIs and severe TBIs, just in terms of categorizing brain injuries, but with concussion specifically, you have it or you don't. Very common misconception is that equipment can prevent concussions. There is currently no protective device that can prevent a concussion. Now, it can reduce the risk, right? A good fitting helmet is certainly recommended, and I highly, highly recommend that, especially for kids in contact sports, snowboarding, biking, things like that. But at the end of the day, our brain can bounce around the skull with whiplash or with hitting our head, no matter whether a helmet is there in place or not. Another one is that if you're not knocked out, it's not a concussion. So we know that this is not true. Less than 10% of all concussions involve a loss of consciousness. So 90% of injuries do not involve a loss of consciousness. You can still get a concussion if you are conscious. Another is that concussion symptoms always appear immediately. For some people, symptoms may not become recognizable until they return to cognitive activity or physical activity. Also, for athletes, for example, if they get injured in a game, the adrenaline from a game can mask the symptoms of concussion. And so that's why it's so important that when in doubt, if a kid gets hit in the head during a game and they're exhibiting subtle signs, it's important to remove them and evaluate further for a concussion. And then another misconception is that you shouldn't sleep after a concussion. Some of you may have heard you should wake up your kid every few hours after an injury. We now know that good quality sleep at night is so important for the brain to heal. As long as there's no emergency signs of perhaps a brain bleed or a skull fracture, which are very, very rare. We'll talk about that in a few moments. But in general, we want to make sure that people are getting good restorative sleep because that's where the most healing occurs, is in that nighttime sleep. Okay, so in terms of recognizing concussion in neurodivergent youth, neurodiverse individuals, they experience symptoms in perhaps less obvious or unexpected ways. We'll talk more just about the general signs and symptoms of concussion to just help you recognize the signs in general. But then we'll talk a little bit further about how that may present in neurodivergent individuals so that we can respond effectively and ensure the best outcomes overall. All right, so I really love this graphic. This was produced by the Brain Injury Association that shows the different categories of symptoms of concussion. The signs and symptoms fall into 4 general categories. These include physical symptoms, sleep, emotional symptoms, and cognitive. So for example, 2 of the most common symptoms of concussion fall in that physical category: headaches and dizziness. Very common symptoms that are temporary. Sleep is often disrupted, so troubles falling asleep, staying asleep, or both. Emotional symptoms are very common. Maybe your child is more irritated or more down than usual. And then cognitive symptoms are certainly present. One of the most common is mental fogginess, feeling like you're in a cloud, can't think clearly, memory difficulties, word finding troubles, and slowed reaction time. So parents, teachers, friends, you know your loved ones best. And if something seems off after someone hits their head, there may be a concussion in the picture. Now, something you might notice with these symptoms is that they're not unique to concussion, right? People might have a history of headaches without ever hitting their head. People might have allergies, and that can cause headaches, right? People can have cognitive difficulties due to other conditions, right? We know that individuals with ADHD have troubles focusing. It might not necessarily be a concussion. So this is why it's so important for your child or loved one to see a concussion specialist to be able to tease out these symptoms to determine, is this a brain injury, or are there some other explanations in the picture that might be driving their symptoms that we're seeing? Then I also just want to point out that many of these symptoms are not visible. So this is all the more reason why I'm passionate about educating the community so that we can speak up if we are experiencing these symptoms after a bump to the head. Okay, so like I mentioned, many of these symptoms of concussion are present even without a concussion, right, in neurodivergent individuals. And so recognizing these subtle changes is really important. And thinking about, you know, some of them might have these baseline symptoms, but can they do these things as well as they normally do? So things like following instructions. Someone may have a baseline difficulty of following instructions, but perhaps this is worsened after an injury. Keeping up with conversations. So this goes back to that slowed processing speed, right? Might have difficulty keeping up, responding appropriately or timely, finding words when talking. So individuals can certainly have difficulties with word finding in general, but we can see this worsen after a concussion. Things like problem solving might become more difficult. Remembering things. So of course in school we might see this, but even remembering things around the house or remembering conversations that maybe we had with our child earlier. And then completing tasks without confusion. Increased confusion is very common after a concussion and can certainly be heightened in neurodiverse individuals. In terms of those physical symptoms, now, again, we're talking, are they appearing to be experiencing these symptoms more than usual? So things like fatigue is very common. Changes in sleep schedule. So now sleep difficulties may be present at baseline, but even greater trouble sleeping through the night, for example, or feeling like we need a nap during the day to just get through the day. Being in discomfort or more pain than usual. Greater balance or coordination troubles, very common. Changes in preferences or favorite things. This is a very subtle behavioral change that we can often pick up in especially younger kiddos. New or increased sensitivities. So things like sensitivity to light, noise, and touch certainly can be heightened after an injury. And then less of an interest in a variety of activities, but especially with eating. We can also see that. And in terms of those emotional symptoms, again, we're talking more than usual. Is your kid more irritable than normal? Maybe has a shorter fuse, more cranky, more anxious, worrying more often? Do they appear more down or sad than usual? Are we maybe seeing emotion dysregulation heightened more than we did at baseline? So all things considered, with younger kiddos especially, focusing on those emotional and physical signs are important. Some of those cognitive symptoms might be harder for them to express, and that's where us as professionals and as parents and teachers and coaches, it's really important that we're able to pick up on these subtle signs. And again, you know your kids best, and so any of these subtle changes might be an indication of an injury. And with neurodiverse individuals in general, they may have trouble describing symptoms in general too. So looking for those subtle visual signs, outward signs can be important. And again, symptoms of concussion are not unique to concussion. They overlap with many neurodevelopmental conditions and behaviors that normally occur. And so we're looking for, is there a worsening of these symptoms? Are they occurring greater in frequency, for example? These subtle changes can really make a difference. So in summary, my take-home message is encourage everyone to tell someone, either a parent, a teacher, a school nurse, if something feels different after hitting their head, because it's better safe than sorry, better to get it checked out. So then we can get them on the path to recovery if there is an injury there. Now, I alluded to this earlier in terms of some red flag or emergency signs and symptoms of concussion. These are very, very rare and typically occur within the first 72 hours after an injury. But these are some symptoms that may indicate a more severe injury, things like a skull fracture, things like bleeding in the brain. And in these cases, going to the emergency room is certainly recommended. The emergency room can be costly, and so I always encourage people, yes, go to the emergency room if these symptoms are present, or if there are greater medical injuries present, things like cervical pain, numbness or tingling, right? But more often than not, people do not experience these things. So things like repetitive vomiting, we're talking 5 or greater times in a day. Decreased responsiveness, so they're not conversing back. Slurred speech. Someone describing the headache as the worst headache of their life. They can't tolerate it. Unusual behavior, again, out of character for them. You might see severe agitation. Increased confusion, disorientation. They're not sure where they are for an extended period of time. Certainly, seizures would warrant a visit to the emergency room, and lengthy blank stares. Okay, so to transition into the neuropsychologist role in concussion management. So many people don't know what a neuropsychologist is. For those who don't know, a neuropsychologist is a medical professional who applies the science and understanding of how our brains affect how we behave in our daily life. Neuropsychologists are doctoral level healthcare professionals who completed many, many years of training and then an internship and a postdoctoral fellowship of training focused in neuropsychology. So we're talking 8+ years of training, but who's counting? Neuropsychologists provide various different services. So they evaluate and test patients, they provide treatments and follow-up, and specific to concussion, provide return to school and return to play plans. So in terms of the evaluation and testing, traditional neuropsychological evaluations for children getting evaluated for ADHD or learning disabilities, for example, or older adults being evaluated for dementias or movement disorders or stroke. We are experts in testing how the brain functions and diagnostically to say, is a condition there, is it not, and what do we do with this information? Specific to concussions, there is a subsection under the umbrella of neuropsychologists, of sports neuropsychologists like myself. And these individuals were some of the first to create tests, neuropsychological tests, that diagnose concussion and can also help us manage the injury. And so neuropsychologists also provide treatment and follow-up for a concussion. They're able to recommend specific treatments for the injury, given their in-depth understanding of all of the factors that can affect recovery. And this includes pre-existing conditions, right? In our neurodivergent youth, did we have ADHD in the picture before? How is that impacting recovery? What recommendations can we make? And we'll talk a little bit more about what those treatments are in a moment, and some of those factors that can affect recovery. And so the why here, why see a neuropsychologist for concussion care? Many people do see patients with concussions. For example, your pediatrician knows your child best, right? Oftentimes, pediatricians will refer to me because they don't feel comfortable clearing their kid to get back into sports. This isn't their bread and butter. Sure, they may have had a class or a training or a CE credit on this injury, but the brain is complex and humans are complex, right? So that's where neuropsychologists and their expertise really play a good role in rehabilitating and managing this injury. We did years of training in the brain and behavior, and so a concussion is an injury to the brain that affects behavior, right? So neuropsychologists are uniquely suited for this injury. Like I mentioned earlier, concussion symptoms are not specific to concussion. They look like many other things. And if we only looked at concussion symptoms on paper, so after an injury, someone was endorsing mood changes or attention problems, neurodiverse individuals may not ever look like they're recovered. And so this is where a neuropsychologist is able to come in and tease out what might be explained by the long-standing conditions that an individual has, or is this the concussion driving these lingering symptoms? Now, there's many tools that are in the concussion space that are used to treat this injury. Many of these tools, unfortunately, are not research-backed. Neuropsychologists are especially helpful because they use validated tools. They have developed well-researched evidence-based tools to evaluate subtle deficits or unreported symptoms. People always ask me, how do you know that this kid just is lying about their symptoms, saying that they're okay so they can play in their game on Friday night? Well, we have measures that can pick up on very subtle things that would suggest an injury may still be there, even if the kid was trying to mask their symptoms. We also guide treatments based on evidence-based interventions and based on the latest research. So part of that schooling, those 8 years plus of studying the brain and behavior, involves coming from a scientific background and understanding and staying up to date with the literature on this injury. It's ever evolving, it's evolving every day, so we have to keep up. Another huge factor here is comprehensive and coordinated care. Oftentimes, and especially in neurodiverse individuals, it takes a village to treat this injury. And I like to say neuropsychologists can serve as the quarterback of concussion care, right? Patient comes in and sees us, we do our workup, we make our recommendations, and then we throw the ball, pass it off to any other individuals who may be helpful in this patient's recovery based on their individual characteristics and traits. And then finally, education on this injury is key. Anxiety around this injury is common. However, anxiety and heightened stress, we know, can actually prolong recovery from concussion. And so neuropsychologists are uniquely suited to help educate the patient and their parent about what is happening in the brain. And this injury is treatable. How are we going to treat this injury and get you back to your baseline? Neuropsychologists are psychologists first, right? So very oftentimes I will put my therapist hat on, do a lot of education with families. And neuropsychologists test for concussion specifically. Now, like I mentioned earlier, neuroimaging, brain MRI, CT scans, they don't pick up on concussions. What they do is rule out any kind of structural injury or brain bleed. So neuropsychologists have tests that are sensitive to very mild effects of acute concussion, so even 24 hours post-injury. Now, most of you who know neuropsychological testing know that it can be quite lengthy. It can be several hours of really doing in-depth testing, and that certainly is needed for neurodevelopmental conditions, for other neurological conditions we're trying to identify or rule out. But with concussions, especially in that acute phase, there are brief neuropsych tests that we can actually administer and pick up on these symptoms and signs to really help streamline care. We want to make sure that care is easy. Hour or less, we can get you back with a plan to get back to your daily life. All right, so in terms of returning back to school and back to play, so talking more about some of these interventions. So more often than not, I get patients who walk into my office and say, I was told by my primary care provider to rest in a dark room for a week. We actually know that that is harmful. This was formerly known as cocoon therapy. Don't expose yourself to cognitive activity. Don't let yourself exercise. We now know that too much rest can be detrimental. So instead, a gradual return to activity is now the gold standard. Now, this, of course, is under the guidance of a medical professional. I'm certainly not encouraging people to just go out to their daily life at 100% and trying to navigate this on their own. This is where specialists come in and can really help develop these fine-tuned treatment plans for you all. So your kid hit their head. They're showing some signs of concussion. Maybe they're communicating some signs and symptoms too, because they've been educated on this injury and they're aware of what to look out for. If it happens during an activity or they have activities or sports planned for later in the day, make sure you remove them from their activity to prevent further injury. That is my number one recommendation. We want to prevent further injury as much as we can, because getting a second injury while our brain is still fragile and while it's healing can really complicate recovery. So that is the number one goal here, reduce risk of further injury. Second step is to notify caregivers, notify providers, contact a medical professional to get care as soon as you can. Follow the concussion specialist medical advice. So relative rest, we'll talk a little bit more about what that means, but first 48 hours, of course, it's okay to rest the brain. But then an active recovery is what we know is best for the brain to heal. Gradually returning to school and play, of course, with those individualized plans and guidance from medical professionals. And then during that time, avoiding contact sports and activities until officially cleared by that medical professional. We want to be confident that their brain is healed before they might bump their head again. So returning to school specifically, cognitive exertion is important during concussion recovery, so we want to make this a priority. Researchers have also showed that returning to school within 3 days of a concussion is linked to fewer symptoms 2 weeks later. So I'll often see kids who have been held out of school for 2 weeks, maybe even longer, and they come into my office and they don't know how to navigate reading a book because they've been sitting there and not working their brain. So we want to keep their brain active slowly and gradually while returning them back to their daily life. Like I said, academics are the priority here. Of course, getting kids back to activities and sports are very important, but we want to make sure that we're getting our kids back into school as soon as possible. And the expectation is that the kid is devoting as much time to academics within reason while managing symptoms. And symptoms are expected at school, and it's okay. We will have some plans in place, and I'll talk a little bit more in a minute about things we can do to manage symptoms because they will happen, and that is normal, and it's temporary. Now, of course, this isn't without challenges, right? Depends on the time of year, but meeting the requirements for classroom curriculum can be difficult. There might be state or school requirements, perhaps during times of standardized testing, not knowing what to do. Kids might fall behind in class. That can increase stress, increase anxiety, and we know that that can prolong recovery. So these are all things that we manage in the office, and we develop tools and accommodations in the short term. So on that note, these are just some common school tips that I provide based on the individual's presentation, the symptoms that they're experiencing, for example. The number one recommendation is taking adequate breaks throughout the day. The brain essentially just needs to recharge, right? When we have a concussion, our brain's battery is being depleted faster than normal. And especially for kids who are neurodivergent and maybe their brain's battery is already reduced, we need to implement more breaks throughout the day to recharge intermittently. Symptoms often occur when we're pushing our brain too much. And so we want to reduce that and get ahead of that fatigue and symptoms by managing our energy levels throughout the day. Reducing work. So oftentimes working with teachers to say, is this homework or is this quiz absolutely necessary for their grade? Or can we eliminate anything that isn't necessary and try to work together to make sure we're managing this kid's stress so that they don't fall behind in school. Now, screen time is one of the number one questions I get asked, especially today. We're surrounded by screens, right? Kids are using screens in school. How do we navigate this? My recommendation is always no more than 2 hours of leisurely screen time. So using screens is actually okay, but being cognizant of how we're feeling while using screens is really important. So if you notice that you're getting a headache while using screens, that's just a sign we need to take a break. We don't want to completely eliminate screens because by the time it's time to go back to school or to work, going from 0 to 100% is going to be a shock to the brain. And we want to minimize anything like that by just gradually exposing. Now, returning to play and to sport is a huge aspect of what I do as a concussion specialist. Athletes are actually required by state law to complete a return to play protocol. All 50 states have some form of youth concussion law that requires medical clearance to get back to their sport. Return to sports and physical activity is a gradual process, and as the patient improves, we increase physical activity. Avoiding contact activity, like I've mentioned, is crucial to avoid further injury, because if another injury occurs, it can be harmful and prolong the recovery process. Now, contrary to common belief, movement is treatment. Now, all of this, of course, is under guidance of a medical professional and a plan that they will provide. But exercise is so, so important, especially in the early stages. If we think of the brain like an ankle, right? Similar to other injuries, if you're going to sit in a room and not move and just rest, that ankle is not going to get better. We have to rehabilitate it. We have to start to move it so we can get back to our baseline. And the brain works the same way. Extended rest, not helpful. We now know this. And this, of course, is done in a controlled and supervised environment. So your doctor will have you start with light activity, gradually increase the physical activity. So interventions and referrals, in terms of being that quarterback of concussion care, what does recovery look like, and what are some other team players that are involved? Well, first, before talking about that, people ask me all the time, how long does it take to heal? And the blanket answer is, it depends. Every injury is unique. Every person is unique. Pre-existing factors can play a role in terms of recovery time. Now, a minority of people show symptoms longer than 1 month, so 5 to 20% on average. So most people do recover within a month with the proper care. Now, these are some risk factors for a longer recovery from concussion. We're looking at psychiatric histories. There is some research that neurodiverse individuals do take longer to recover. Other factors like being injured in a motor vehicle accident, migraine history, high symptom severity at baseline. And even there's some research that some females may take longer than males to recover. The jury's still out, but there may be a role of hormones there. So all of these factors play a role in our recovery. Now, timing is key. So the earlier you seek specialized care, no matter if you have these risk factors or not, the earlier people get back to daily activities and the faster they recover on average. On the other hand, the longer you wait to seek care after a concussion, the greater risk of a longer or more complicated injury. So especially in our neurodivergent youth, we want to make sure they're getting specialized care as soon as possible so we can stay on top of these symptoms and really create an individualized treatment plan to get them back to their daily life. So those other team players who may be involved in one's concussion care include physical therapists. So I mentioned that dizziness is a very common symptom after concussion. This is due to something that's called vestibular dysfunction after an injury, and that is outside of a neuropsychologist's wheelhouse. I very commonly refer to physical therapists to treat that. Of course, physicians working hand in hand with pediatricians, making sure we're all on the same page is important. Vision therapists, neuro-optometrists or ophthalmologists are especially helpful if there's anything like blurred vision, double vision, things like nystagmus, shakiness in the eyes can be very helpful. Neurologists may be in the picture if there is a skull fracture or perhaps severe migraines and medications need to be adjusted. Psychologists are a very common referral too. Sometimes we need that extra professional help to help cope with this injury and its impact on our daily life. And psychiatrists as well, if needed. So some closing thoughts. When in doubt, get checked out. It's better safe than sorry. If a kid hits their head, they're showing any signs, go see a specialist and just make sure that an injury is not there. Or if it's there, we'll get the right care. Concussion symptoms may manifest differently in neurodiverse individuals and sometimes in less apparent ways. The brain does heal from this injury, and I want to emphasize that. With the proper care, we can get you back to your activities and your daily life as soon as possible. Most people recover within 30 days. There's significant variability in what this injury looks like between people, but also within the same person. Say someone had an injury today, then they have an injury 10 years from now. They will look very different. Neuropsychologists are uniquely equipped to manage this injury, and especially when there's pre-existing neurodevelopmental or psychiatric conditions. And finally, individualized care is essential for concussion treatment. So just a quick plug for our concussion clinic. Like I mentioned, I am the concussion clinic lead and provide expert evaluation and personalized care for individuals as young as age 6 and as old as 106. So really provide that fine-tuned care, especially for people with comorbid conditions, helping you get back to your daily life, knowing and teasing out all these factors that might be contributing to your concussion and your recovery. And these slides will be sent out, but these are some excellent resources that I wanted to provide. The CDC Heads Up has some good basic educational resources, especially talking about this injury with our kids. Has very good ways of describing what a concussion is. The Sports Neuropsychology Society has good resources also for the public and also can help you find a sports neuropsychologist if interested. These providers are located all over the US, so if you're not located in Colorado, you can find someone on there who is located in your state. And the Virginia Concussion Initiative Toolkit is really great. They have a neurodiversity toolkit specific to a lot of the information that I shared today in terms of signs and symptoms and what to do when seeing this injury and recovering from it in neurodivergent individuals. And like I said, this is my favorite topic. I'm happy to speak anytime about it. Please reach out to me, shoot me an email. I'm more than happy to chat.
Thank you so much, Dr. Datoc. That was amazing, full of so much detail, so much information. I have not seen any chats or questions come through. So please, if you do have a question, put that in Ask Away, since we have this amazing specialist here. One question that I do have, is thinking about insurance coverage. So is the neuropsychologist specific to concussions covered under insurance or Medicaid, or what does that look like?
Yes, depends on the provider, of course, and whether they take insurance or not. I can speak specific to our clinic. So because our evaluations for concussion are brief in nature, you're not going to spend what a typical neuropsychological evaluation typically costs, which can be costly, right? So our clinic does offer these concussion evaluations, initial visit and a follow-up for $350 total for cash pay. Then we also offer a lot of major commercial insurances. They're all listed on our website, but oftentimes insurance does cover the cost, just depending on your deductible.
Okay. Yeah, because I know when, usually the first line of sight for most parents is going to be, their pediatrician or, primary care, whatever that looks like.
Yeah.
What level of specialty? Because I know just in general, especially from my personal experience in, working with providers in the lens of neurodivergent support, it's so tough because we get a lot of, I don't know how to phrase it, but lackadaisical is what I think about just when we talk about symptoms in general. How should parents advocate? I mean, I talk to some of my parents where I'm like, trust your gut instinct too. So many providers I've heard, oh, they'll get better, or this isn't this, or this is, and it's just so unfortunate.
Yeah,
Um, so how would you advise parents as far as, you know, what next steps should be taken? Or I'm not saying that the providers don't know, so don't get me wrong, because I think a lot of good information, but I think we also need to be cautious about the information we're giving for somebody who may not be a specialist in that specific area.
absolutely. Absolutely. And I like to liken it to, if you had an orthopedic injury, sure, your primary care, your pediatrician might know some things, but they're not going to be the right person to do the surgery on you. Specialty care, this is why we have experts in each of our fields. We are experts in certain areas and not in others, and it's important that we stay in our lane. So specifically for parents and specifically for care for neurodiverse individuals, making sure that that provider is knowledgeable in terms of neurodevelopmental conditions and just is neurodiverse affirming in general. And then neuropsychologists, again, and I know I'm biased, are uniquely equipped for this because we do have the background and training in these pre-existing conditions, as well as any dysfunction of the brain, right? And so that's kind of what makes us uniquely suited for this injury and with these populations. But I do know at the end of the day, it's what parents are most comfortable with, and oftentimes that is the pediatrician. But as you were saying, being cognizant of the information you're receiving. Is it really specific to your kid and their symptoms and where they usually are at baseline? Or do we need to maybe seek a higher level of care of someone who really is an expert in this area?
Thank you. Um, I'm not seeing any chats or any questions. Anyone have anything that they want to share or add or ask? If not, I put it in the I sent a chat to everyone that a copy of the recording as well as the presentation is going to be sent out. Um, so appreciate this level of information. Like I said, after 5 years, this is the first one focused on this. And so thank you so much for what you do. And I think it's such an important topic to discuss.
I'm
So
biased, but I agree.
yes, yes.
Yes,
Well, I
yes,
don't see anything, so I'll give you guys a few minutes back of your time. Thank you again, Dr. Datoc.
yes.
Thank you for all that you guys do and for being an amazing member of the Guiding Bright Minds Provider Directory and the support of this community. So, all right, everyone, have a great
Absolutely.
afternoon.
Take care, everyone. Bye-bye.
Thanks. Bye.